Into reports, explosion happened while cars on a scheduled military-escorted convoy, which transporting passengers from Damboa to Maiduguri on Saturday, leaving several others with varying degrees of injuries. The Maiduguri-Damboa road links Maiduguri to several local government areas in southern Borno and has been a hotspot for Boko Haram terrorists for over a decade. The road was closed to vehicles and commuters until the administration of Babagana Zulum opened the road for passengers to travel to Damboa, Chibok, and other local government areas in southern Borno with the help of a military convoy serving as security cover for the commuters. The injured persons, whose numbers are yet to be specified, have been conveyed to a hospital in Maiduguri for prompt medical attention. The Kaduna state government has rescued 13 children who were allegedly stolen from the state and sold to child traffickers in Kebbi, Calabar, and Cross River State, Enugu, and Anambra State. The State Commissioner for Human Services and Social Development, Rabi Salusi, disclosed this during a press briefing on Saturday. He said the victims were first taken to an illegal orphanage home in Abuja, the nation's capital, from where they were taken to other states by a child trafficking syndicate, currently at large. They were allegedly stolen from Kaduna State by a child trafficking syndicate and taken to Calabar, Enugu, Anambra, and Kebbi State, where they were sold to prospective buyers. The Kaduna State government, in collaboration with security agencies, were able to rescue the children, most of whom were kidnapped a few days after birth. According to the commissioner, 5 members of the kidnapping syndicate are currently in custody, confessed that their gang leader operates an orphanage which serves as a temporary shelter for the stolen children before they are later sold to prospective buyers in the southern part of the country. And now to politics. The national chairman of the ruling All Progressives Congress, Ndlea Ganduje, has dismissed talks of an opposition measure ahead of the 2027 general elections, describing the move as a futile alliance that is doomed to fail. Ganduje, national chairman of the APC and the party's National Working Committee, had visited former President Muhammadu Buhari on Friday, hours after opposition leaders met with the former president. The APC chieftain made the remarks on Friday while speaking to journalists after leading the APC National Working Committee on a Salah homage to Buhari at his residence in Kaduna State. When asked about ongoing discussions among major opposition figures, including former Vice President Atiku Abubakar, Ganduje was quick to brush aside any notion of a serious threat to the ruling party. The APC chairman touted the party's political dominance, noting its control of 21 states and declaring it still the strongest party in West Africa. He added that the APC was not only focused on maintaining its hold on power, but also expanding its influence ahead of the 2027 polls. In Sokoto State, chairman of the People's Democratic Party in the state, Muhammad Goronyo, has launched an attack over the performance of the All Progressives Congress-led government in the state, accusing it of poor governance, mismanagement, and insensitivity to the plight of the citizens. Speaking with journalists at the PDP Secretariat in Sokoto on Saturday, during a quarterly meeting of current and former party executives, Goronyo described the current administration as anti-people and anti-progress, stating that the APC has dragged the state backwards since taking over in 2023. Goronyo criticized the state government's handling of local government finances, alleging that despite claims of savings in local councils, no meaningful development has taken place in any of the 23 local government areas. He also rejected the federal government's recent assertion that security has improved nationwide. According to him, the situation in Sokoto is deteriorating daily, with frequent cases of killings and kidnappings. In the meantime, the suspended senator representing Kogi Central, Natasha Poti-Dugan, has called on the Inspector General of Police, Kayode Egbetokun, to dismiss a petition by the Senate President, Godswill Akpabio, accusing her of criminal defamation and incitement. She instead urged Egbetokun to probe Akpabio for allegations of threat to her life. Akpabio had earlier written to the police chief, alleging that the senator falsely accused him of plotting her assassination, a claim he described as heinous lies aimed at damaging his reputation and inciting unrest. However, in a statement on Saturday by her counsel, Victor Giwa, Natasha accused the Senate president of attempting to preempt investigations into his alleged role in a plot to harm her by raising counter-allegations of public incitement. She insisted that Akpabio's petition was a deliberate ploy to distract law enforcement from more pressing allegations against him. In Edo State, Governor Monday Okpebholo has berated the Edo State chapter of the People's Democratic Party, PDP, for taking his support for President Bola Tinubu's administration and his policies out of context. In a statement by the governor's chief press secretary, Fred Itoa, on Saturday, Okpebholo described the party's statement against the governor as weak. The statement said at no time did the governor violate any section of the Electoral Act, as falsely alleged by the Edo factional PDP. It added that the governor, like every well-meaning Nigerian, reserves the right to express support for the president's vision and administration. In Lagos State, the Inter-Party Advisory Council, IPAC, in Lagos State, has faulted the Lagos State Independent Electoral Commission on the release of guidelines for the 2025 government election in the state. IPAC, in a statement jointly issued by the chairperson, Temilade Akinade, and Public Relations Officer George Ashiru, on Saturday, said the commission erred in the way it released the guidelines. Last year, had on Friday announced July 12 as the date of the election in 20 local government areas and 37 local county development areas, while reacting IPAC, the umbrella body of all 19 registered political parties in the state, said last year disregarded established communication protocols in the release of the guidelines. The council criticized the commission for not engaging political parties on important issues on the election prior to releasing the guidelines, as well as shrouding so many things about the election in secrecy. The chief of the Air Staff, Air Marshal Hassan Abubakar, has called for the nationwide adoption of the Nigerian Air Force College of Nursing Sciences, pioneering Air Mobile First Aid training, describing it as a critical step forward toward transforming emergency healthcare delivery in Nigeria. A statement on Saturday by the Director of Public Relations and Information, Nigerian Air Force Headquarters, Air Commodore Ehiman Ejodem, said the Air Chief was represented by the Chief of Medical Services, Air Vice Marshal Anthony Ekpe, who spoke during the matriculation for 120 newly admitted National Diploma 1 Set 6 students of NAVCONs held at NAV Base Kaduna. According to Air Abubakar, the Air Mobile Force Aid training designed to equip nurses with rapid response capabilities in challenging environments, including aeromedical evacuation and austere conditions, has the potential to become a cornerstone of the national nursing curriculum. He also praised the collaboration between NAVCONs and the Nigerian Air Force School of Medical Sciences and Aviation Medicine, calling it a model of readiness for crisis response and emergency care in complex terrains. Abubakar commended the college's ability to produce competent and compassionate healthcare professionals while fostering unity by training both military and civilian students in a values-driven academic environment. The National Drug Law Enforcement Agency, Ndlea, has destroyed 1.6 million kilograms of assorted illicit drugs in what the agency described as the largest single volume of narcotics ever destroyed at once in the agency's history. According to a statement on Saturday by spokesman Femi Babafemi, the agency said the exercise was conducted at a remote location in Ipara along the Lagos-Ibadan Expressway in Ogun State. The illicit substances destroyed included 123 kilograms of cocaine, 46.8 kilograms of heroin, 1.4 million kilograms of cannabis, 148,000 kilograms of codeine syrup, 3,244.26 kilograms of tramadol, 1,544 kilograms of squishes, and 111 kilograms of methamphetamine, among others. The destroyed drugs were from Ndlea Zone 9 and Zone 11, which include Lagos Strategic Command, Ogun State Command, Oyo State Command, MMRA Strategic Command, and various border commands.
We are witnessing the public destruction of confiscated drugs. An occasion such as this is a testament to our steadfast commitment to tackling the scourge of drug trafficking. The sheer volume of seizures, which totals approximately 1.6 million kilograms, serves as a reminder of the grave danger these substances pose to public health until they are completely and irreversibly destroyed. The National Drug Law Enforcement Agency, Ndlea, operates under a clear mandate to reduce these narcotics to rubble. At all times, we discharge this duty with the utmost seriousness and diligence. Some may ask, why such an exercise is conducted publicly? The rationale is simple: to show transparency and accountability. By making this process open, we affirm our collective resolve against the insidious activities of illicit drug trafficking. It is important to clarify certain misconceptions. This exercise is not merely symbolic, it is forensic, grounded in evidence. Random laboratory tests are carried out to confirm the authenticity of the seized items. The substances are destroyed with the approval of the court after the cases linked to them have been brought to closure. Following arrest and successful prosecution, today's event represents a significant milestone. It is the
Safe Motherhood Day is set aside to increase awareness about the health and safety of mothers and act as a strong reminder of the necessity to provide safe and respectful maternity care for every woman. Celebrated every year on the 11th of April, it is also a vital initiative, a focus on enhancing awareness about the significance of adequate health care for pregnant and lactating women. A Safe Motherhood Day 2025 is being marked under the theme, Healthy Beginnings, Hopeful Futures. Joining us to discuss this on the news at 7 is Adolescent and Youth Reproductive Health Desk Officer in Osun State, Mrs. Roslyn Akilabi. Good evening.
Good evening, ma'am. Good evening, all our viewers.
Thank you for joining us. Today, we want to talk about maternity mortality, and we know it is quite rampant in the country, and it's still a challenge in Nigeria despite improvement. In what ways do you feel we can ensure safe motherhood in the country?
All right. One of the things that we need to do, because when we talk about safe motherhood, it has 5 pillars, and it starts from even before pregnancy. How do we ensure that this woman that is planning to get pregnant, she's in a good health conditions to carry the pregnancy? Then we talk about antenatal care during that pregnancy. We talk about access to obstetric care during delivery, access to ski bath attendant. Then we talk about postnatal care and post-abortal care in case the pregnancy did not end in delivery. And then we also talk about how do we prevent sexual transmitted diseases and HIV. So if we want to ensure that this stage of life is safe for our women, we must ensure that every woman has access to maternal health at low cost or no cost at all. For people in the rural and under the served area who may not be buoyant enough to even pay for these services. And whether we like it or not, the number counts. If a woman dies, generation dies. That single woman has a whole lot of people that surround her that also depends on, that their life depends on her.
All right, there are also concerns that numerous women in rural or disadvantaged areas have complications that arise during childbirth or during pregnancy, which are often preventable. How can this be addressed?
This can be addressed by paying, that our government should pay more focus on rural areas, primary health care centers, because these are the opportunities that people in underdeserved and rural area has to have somebody that will attend to their care. So firstly, we must ensure that we have skilled birth attendants in all our PACs who will attend to this woman. And like we are doing tonight, increase awareness. Let people know that for every pregnant woman, they deserve to go to primary health care centers. They deserve to have access to skilled birth attendants, enough of staying back at home, enough of going to quacks, enough of going to prayer houses, where some of these delivery end up in complications. So we must ensure that we take serious that we have skilled birth attendants at our primary health care centers, which is the closest primary health care centers to the people in the rural settings.
Kate said that the safe motherhood begins with informed choices and timely access to family planning and childbirth spacing services across the country. However, how does family planning ensure mothers are safe and healthy?
Yes, for family planning is gives mother opportunity to make choices. It gives them the opportunity and empower them to say, I want to have my child. Oh, I want to rest for now. I want to postpone pregnancy till some other time. So if you look at it very well, we are looking at the theme this year that says, at the beginning, hopeful future. It begins with the power of choice. Every woman of reproductive age has to be well informed, and they has to be empowered to make choices as to when do I want to have my baby. So that's why family planning is a major pillar. When we talk about safe motherhood, is a major pillar to reduce maternal mortality and morbidity rate.
Okay, across Nigeria as well, it appears states are making investment in family planning and in collaborating with other partners. Can you take us through what Osun State is doing regarding that?
Yes, so we give kudos to our government. Our government is really doing well. And we also advocate for better financing, better funding for family planning and other reproductive health services. And we also have some of our partners that also support us in this state, in Osun State. We have TCI, the Challenge Initiatives, that are also supporting the cost of family planning in these states, and MSI. So they have been helping us to take family planning to underdeserved areas, the rural dwellers, making it available for them, doing what we call high impact intervention, making this available in terms of outreaches. In outreaches, what we do is we are not going to sit down at the PAC waiting for the women to come and ask for family planning. We go to them. We take it to their doorstep. We make it available for them at their community. And we go to different places where we can see women to enlighten them. So these are what the state has been doing, and with the support of some of our partners in the state.
I know that a lot of effort is being put in place to make motherhood safer. What are those challenges that you encounter once in a while?
One of the major challenge is human resources. In terms of, we said if motherhood will be safe, that woman needs to be attended to by a skilled birth attendant. Not everybody can take a woman through pregnancy period, delivery, offering of obstetrics care. So there are trained midwives, obstetrics or personnel that knows how to take them through, because labor most of the time get complicated when they are being mismanaged by people that are not skilled. So one of the major challenge is shortage of the skilled birth attendants, and we are employing and we are also pleading to our government to see to it that we have more, and it's a general thing. It's not about the state, it's the whole world. If you read on the news, you see how many nurses have left this country for a greener pasture. So this amounts to shortage of staff every day, day in, day out. And another thing is this cultural belief and cultural practices. A woman will get pregnant, go for antenatal care, they will have inform the woman, this is what we for example, plan you for CS because of some of other indications, and you see them going back to prayer houses and said, I can deliver on my own. So most of the time, we lose some of these women. And at the end of the day, we may not have statistics that will be able to be precise enough to give us how many women are dying in those houses, in the hands of quacks, in prayer houses, during labor. And this has been the challenges that we are having in terms of people are not taking health insurance serious. We heard from news a woman that died because the husband couldn't pay for the hospital bill. So if they are on health insurance, I think they would have been catered for with it could have been a saving grace for them in the time of that. Because if people are paying out of pocket for health, it may not be easy sometimes, and they may not be lucky, especially people that still at the childbearing. They have to plan. That's why we talk about family planning. So many people don't believe in family planning. They don't want to hear about it. They keep on giving birth until the uterus is tired. They cannot carry the pregnancy again, and they give birth, and the uterus open up, start bleeding, and most of them even deliver in houses, in quack places where there's no service for emergency, and we lose them to childbirth.
You mentioned something about public perception of family planning. What is your organization doing towards this regard? And also, what roles do men play to safeguard, to have a safer motherhood for women?
Yes, in fact, men play a major role. Because most of the time, some of these women they are not even empowered to talk for themselves. They are not empowered even to make decisions on their own. Some of them still depend on their husband to make decisions for them. And that's why we always advocate for men involvement in anything that has to do with reproductive health, especially family planning and making choices. That men should see to it that their women also take up this family planning that we are talking about, so that they can also say, this is when I want to give birth. They give birth based on their plan, by choice, not by chance, because most of those pregnancies that is by chance end up being a complicated pregnancy. So we advocate for men involvement. Our own agency, our state and the ministry, we are doing a whole lot of enlightenment, awareness campaign, or go to market, talk to women, do advocacy to our traditional rulers to help us talk to our men, do advocacy visit to our religious leaders, because people believe in them. If they can come out body and tell their congregation that they should adopt family planning, most of them will do. So these are the things that we do, and we're still advocating for more men involvement.
We've spoken about men, and also we've spoken about women, but let's talk about adolescents now. And some of them will say, oh, no, I'm not a mother yet, or I'm not interested in this conversation. In what way are they involved?
Yes, they are involved, because when we say safe motherhood, or we are talking about women of reproductive age, and statistics have shown that the major percentage of adolescent death that we have among girls, it is pregnancy-related complications. That tells us that we have issues of adolescent pregnancy. And so when an adolescent gets pregnant, it may not end up well because of some other reasons. They are not matured enough. They are not physically fit to carry pregnancy. At times they end up with different complications. And that's why we say for adolescents that are also sexually active, we talk to them to also, the first thing we talk to them about is abstinence. You can say no to sex till you are married and you are fit physically, and in terms of mental health to carry pregnancy. But if you are sexually active, it is also good to adopt family planning methods so that you can delay pregnancy till the time that you are fit and you are ready for that pregnancy.
All right, thank you, Mrs. Rosalyn Akilabi, for this insightful and brilliant contribution to the show. And yes, we've been speaking about safe motherhood in the country, and most especially in Osun State, and the pros and the cons and why it should be considered. You're watching this at 7 on West Spring Television. Still to come. Osun State government says necessary measures are being implemented to prevent the state from experiencing flooding. We'll bring you more on this when we return. Please stay with us. 7 commuters have been killed by an explosion along the Maiduguri-Damboa road. The Kaduna State government has rescued 13 children who were allegedly stolen from the state and sold to child traffickers in Kebbi, Calabar, in Cross River State, Enugu, and Anambra states. The suspended senator representing Kogi Central, Natasha Poti-Dugan, has called on the Inspector General of Police, Kayode Egbetoku, to dismiss the petition by the Senate President, Godswill Akpabio, accusing her of criminal defamation and incitement. And on the foreign scene, Iran and the U.S. today began talks in Oman aimed at jump-starting negotiations over Tehran's fast-advancing nuclear program, with U.S. President Donald Trump threatening military action if no deal is reached. Here in Osun State, the state government on Saturday said necessary measures are being implemented to prevent the state from experiencing flooding. Osun State was earlier this week listed alongside 29 others among states likely to experience flooding in the 2025 annual flood outlook in the Nigeria by the Hydrological Services Agency. The State Commissioner for Environment, Mayowa Adejorin, while speaking on the measures meant to prevent flooding in Osun, highlighted various measures by the Ademola Adeleke administration to prevent flooding. Adejorin, in a statement, said the state has embarked on dredging of waterways and evacuation of waste for easy passage of water. He also said the government has embarked on massive campaigns against indiscriminate dumping of refuse and introduction of penalties against anyone found culpable in the acts. He commended Adeleke for his support for the ministry, which has enabled it to execute various projects designed to prevent flooding. On the